So somebody wanted to know about the relationship of the Starling model, the Frank Starling model. You might know that from the modeling that's used in trachea and also in the heart. But for our purposes, the Starling resistor is for venous sinus stenosis in idiopathic intracranial hypertension. So as you know, the superior sagittal sinus, the transverse sinus, sigmoid sinus down the jug, this is kind of the basic venous sinus system. And at this juncture right here between the transverse sinus and the sigmoid sinus, some patients have narrowing. That narrowing is thought to cause the symptom of pulse synchronous tinnitus because they hear the whooshing sound across the stenotic segment. And so this is a very common radiographic finding of increased intracranial pressure in idiopathic intracranial hypertension, where you have narrowing or stenosis just at the distal transverse sigmoid sinus junction. And the reason it's important in IIH is some people believe that this distal stenosis is acting as a Starling resistor. And just to remind you what a Starling resistor is, inside of this box, pressure can compress a compressible tube. And if the pressure, in this case intracranial pressure, is high enough, it'll narrow the segment. So it's thought that this segment right here is narrowing because it's a Starling resistor. In response to increased intracranial pressure, it narrows. And that narrowing is keeping the flow from coming out of the head. And so that leads to venous hypertension, and that further compromises venous outflow, and it becomes a vicious cycle. And so some people believe this is at least one of the mechanisms for idiopathic intracranial hypertension. And that means we have a strategy for possibly treating IIH, which doesn't involve a shunt or sheath fenestration. You could put a stent across here, a rigid construct, and once you put that in there, then the pressure doesn't make it collapse anymore because this is a rigid construct now. So the placement of a rigid construct stent, venous sinus stenting, has been used to treat venous sinus stenosis in idiopathic intracranial hypertension. But the theory is based on a Starling resistor. A compressible system, in this case the venous outflow, is compressed by ICP, and by replacing the Starling resistor with a rigid construct, a stent, the pressure no longer compresses and the venous sinus stenosis, and presumably the cause of some patients' IIH, is resolved.